Hi, I'm Dr. Sam Dubé. I'm here to talk to you today about turf toe, its symptoms, the underlying cause, and the benefits of different treatment options. The signs and symptoms of turf toe can include pain, swelling, and limited joint movement. If they aren't addressed properly, symptoms usually begin slowly and gradually worsen. Turf toe is essentially a sprain of the ligaments around the big toe joint. What causes turf toe? The injury usually results from the excessive forces on the joint that are associated with running sports, especially on artificial turf. Turf toe can also be caused by a direct injury leading to damage of the bone beneath the cartilage. Even mild but repeated episodes of this trauma can result in severe pain and an inability to walk or run, a devastating outcome for a running athlete. The foot and its functional capabilities maladapt when unhealthy footwear is worn for an extended period of time. Optimally, the great toe and the arch should rise pre-ground contact in anticipation of the activity-related forces that are expected during weight-bearing and propulsion. This pre-ground contact muscle activation results in arch system stability and the ideal positioning of the great toe for optimal propulsion during toe-off. This generates little or no stress on the big toe joint. If this muscle firing sequence does not occur, or the big toe is prevented from rising due to tight restrictive footwear, the propulsion load-bearing forces exert extreme stresses on the big toe joint. It is these stresses that cause turf toe. For proper function, our feet require right stimulus and the right movement. Right stimulus consists of the varied, subtle stimulus that the soles of our feet receive when we walk, especially when we walk barefoot on natural terrain. With each step, there are subtly different sensations. These subtle differences in stimulus keep our brain on high alert so that our body's protective reflexes function properly with optimum muscle function. When our brain is uncertain about what will happen, it triggers protective reflex muscle activations that support our arches even before our feet contact the ground, to ensure that our feet and legs can safely manage the forces generated by the activity intensity of our bodies. As activity-related stimulus intensifies, a progressively higher arch is created. That's why, when they're functioning properly, our arches and toes rise and fall dynamically in response to the varying activity stimulus intensities. This uninhibited dynamic movement is right movement. Right stimulus and right movement prevent excessive stress on the big toe joint and optimize propulsion efficiency. Conventional footwear impairs optimal foot function in two ways. First, most conventional footwear dampens right stimulus. This is particularly true for shoes or insoles that support or cushion our feet. They spread the forces evenly across the soles of our feet, creating sensory input that's muted and repetitive, step after step. Within a short period of time, our brain tunes out the stimulus and simply stops responding to it. As a result, our brain doesn't sufficiently activate the muscles that stabilize our arches and properly align our feet, legs, hips, and lower back before our feet contact the ground. This tuned out brain response is natural, and it actually happens all the time. The same thing happens when we walk into a room and first smell the coffee, and then after a few minutes, we don't notice the smell at all. Second, most conventional footwear, especially footwear that's tightly laced, has snug toe boxes or stiff midsoles or outsoles, restricting the right movement dynamic raising of the arches and toes that is just so critical in the creation of a strong, stable arch system and healthy linear propulsion with the toe-off forces spread across the forefoot. Footwear with stiff, restrictive toe boxes not only impede right movement, it also contributes to the excessive stresses on the big toe joint. Wearing footwear that dampens right stimulus and impedes right movement trains the foot maladaptation that results in the damaging stresses that cause turf toe. Conventional treatment methods for turf toe include the following: immobilization via taping, ice, and conditioning or supportive insoles or orthotics. Now, while these methods may temporarily alleviate symptoms, they don't address the poor neuromuscular function that is the real cause of the problem. In fact, the more we artificially support or cushion our feet, the weaker and the more dependent we become on these types of products. These old school support and cushioning treatment methods are not recommended in any other area of musculoskeletal medicine as a viable long-term treatment option. In fact, today's modern treatment methods for poor neuromuscular function focus on increasing mobility, muscle strength, and proper alignment via proper technique exercise, which requires both right stimulus and right movement. Science has shown that simply challenging the body to do its job is the best way to restore and enhance function. This principle is the foundation for virtually all of today's sports training and rehabilitation programs. To address the poor neuromuscular function that causes turf toe and prevents it from recurring, I recommend the following: walking barefoot on natural terrain as much as possible. This provides the optimal right stimulus and allows for the right movement required for healthy neuromuscular function. To obtain right stimulus in your conventional footwear, use BioPods stim soles. For best results in conventional footwear, use BioPods stim soles in loosely laced, soft, flexible footwear that allows your arches and toes to rise easily. For optimal neuromuscular function while wearing shoes, use BioPods footwear, which are specifically designed to provide the right stimulus and facilitate the right movement that optimize and encourage healthy foot, leg, hip, and back function. Consult with your healthcare practitioner and ask them about employing soft tissue mobilization therapies to address the fibrotic scar tissue that may have formed in the past.